Welcome to Charter California Edition. I'm Brad Pomerance. Our guest is Ed Hernandez, member of the California State Senate. And sir, throughout this year, we've been speaking about one of your bills, which would have allowed nurse practitioners, pharmacists, even optometrists to expand the scope of their practices as a way to provide some primary care, especially with the Affordable Care Act around the corner. Why don't you tell us about what the bill would have done, and then we can talk about where it went.
Well, yes, I agree. With the implementation of the Affordable Care Act, we're going to have an access issue and we're going to have a workforce shortage. So those three professions, we're going to be allowing those individuals to be able to increase their scopes of practice, to play an integral part in the healthcare system. The optometry bill was turned into what we call a 2-year bill, so it's kind of on pause for right now. It's not gone. The pharmacy bill, or the optometry bill, is a 2-year bill.
Right.
The pharmacy bill, we got it off the 2 houses. It's off to the governor, and hopefully,
so as we speak today, it could become law.
Yes, it could become law.
And so explain exactly what the pharmacy bill does.
Well, the pharmacy bill, it's going to be probably one of the most transformative and largest scopes of practice that any pharmacy will have in the state of in the United States of America. But in California, if the governor signs it, it's going to allow pharmacists to be able to increase the number of vaccines that they can give out to patients.
My dad's a pharmacist,
so
and he gives flu vaccines as we speak.
So he'll be able to increase what he can. He'll be smoking cessation prescriptions as well as oral contraceptives. But also they can apply for what's called an advanced practicing pharmacy certificate, which will allow them to work in collaboration with physicians to actually alter medications and deal with chronic disease management in facilities with physicians.
So we'll see what happens as we speak. It's on the governor's desk. By the time this airs, it may have already been signed or vetoed, but as we speak today. Okay, but the nurse practitioner bill, that was the one that received a lot of attention. I have been, for example, to a dermatologist's office, and a doctor will walk in and perform a procedure, and then I find out that she actually was a nurse practitioner, and her work was just as good, in my perception, as MD. But continue, sir.
Okay. In the healthcare system that we have now, I would venture to say that most patients that go into a healthcare facility are seen either by a physician assistant or a nurse practitioner who does most, if not all, of the primary care entry and the work on those particular patients.
And it's interesting, those titles at some level are deceiving. When you hear the word physician's assistant, it feels as if they're much more subordinate to the doctor, but these are trained medical professionals with advanced degrees. And same with nurse practitioner.
Well, especially with a nurse practitioner, they are advanced practicing nurses with a minimum of a master's degree, and most of them now are getting doctorate degrees with residency programs and advanced training. 17 states in the United States allow nurse practitioners to practice independently, and there has been decades of evidence showing that they're safe, effective, cost-effective, and better patient outcomes and satisfaction.
And so your bill, you were looking to allow these nurse practitioners to practice independently, to increase their scope of practice, especially since California is one of the states that is fully adopting the Affordable Care Act with the exchanges as well as the Medicaid expansion.
Yes, very much so. And the reason why I felt important that they be independent is because nurse practitioners today in California have to be associated with a physician. So if a physician does not go to a community of color, does not go to the rural community, does not accept Medi-Cal, those nurse practitioners can't do that either.
And so your bill made it out of the Senate, it went to the Assembly, and to the consternation of some, it died.
Yes.
It died in the Assembly. What happened?
Well, as you said, it got through the entire House of the Senate. It went to the Policy Committee with an over 2-hour hearing in the Policy Committee in the Assembly, but through the appropriations. Now keep in mind, the Appropriation Committee only deals with a cost to the state of California for that particular bill.
So why did it go to Appropes?
Because all bills, there's some cost to it.
Okay.
And this particular bill had very minimal costs. It would have been passed on to the licensees.
Right.
It would not cost us, it would have cost the state very little money, but it still died there because of the politics of the California Medical Association that did everything they could to stop that bill every way along the way, and they convinced, or more importantly, they scared enough individuals in that committee to not let it out.
And I have to say, you know, the CMA, we know in the first half of 2013, donated $1.2 million to Sacramento elected officials. And I'm not trying to cast specific aspersions, but it really begs the question about who's being served here.
Well, the California Medical Association is a very powerful lobby in the state of California, and they have the attention of a lot of members. And when you're dealing with a committee that deals with a cost to the state with very little in that particular bill, but they yet were able to convince those members not to allow that bill out of that particular committee. But saying that, I am convinced that nurse practitioners can, will, and should play a role in healthcare. I'm committed to bringing it back. I can't tell you when.
Is it now a 2-year bill? I don't know the parliamentary procedure.
No, had I turned it into a 2-year bill, we could have resurrected it, but my thought was I'd rather just start all over and reintroduce the bill, and we will, and I will reintroduce that bill at some point.
And what's interesting is you had amended the bill to require that nurse practitioners be placed in hospitals or clinic settings in order to have that increased scope of practice, and that apparently wasn't enough.
It was not enough. It was not enough for one reason, because it still had the term independence in there. Now, originally there was 2-path mechanism for a nurse practitioner to become independent, either through specific hours, they go on their own, and the other pathway was through some type of working with a facility. There was a lot of opposition for the first pathway. We took it out. But for a nurse practitioner to become independent in the state of California, they had to be affiliated with a hospital.
Under the revised bill?
Under the revised bill, a federally qualified health center, a medical group, or a risk-bearing medical entity. In other words, they still had to have some connection to some kind of medical facility.
So you want to bring a version of the bill back. What will you do? You seem to have met the concerns or tried to meet the concerns of the opposition. What else can you do?
Well, those concerns were the concerns of the members in the committee, but the opposition was still and has and will, I anticipate, will still continue to be in opposition. But a lot of things change in the political process. Number one, leadership changes, committee makeup changes. So,
and the Affordable Care Act next year will be in place, and we'll see whether there is that dearth of medical professionals that is predicted as we expand those that are covered by health plans.
Well, I would anticipate that California will be successful in its implementation, but I would also predict that because of it, we're going to have so many more Californians that are going to not have access to primary care. And I don't want to get to the point where I said, I told you so, but that may have to happen.
And let's talk about that, because that is really the underlying intent behind much of the ACA, is that we don't want individuals using emergency rooms for primary care purposes. We want them to going to primary care physicians or medical professionals. How are you feeling about that likelihood? We are expanding Medicaid here in California, Medi-Cal, yet we're decreasing reimbursement. The exchanges are up and running, presumably effectively. What's your sense?
Well, I mean, I always said, and I continue to say, that California has and is and will continue to lead the way in the implementation of the Affordable Care Act. California is going to set the standard, and I honestly believe that at the federal level, the success of the California exchange will be the success of what's going to happen in this country. Saying that, we're going to have a dilemma. We're going to have individuals in areas that have the greatest need that are still going to have access issues, but I believe it's incumbent upon legislators to make policy decisions to make sure that we can address that, whether it's building more medical schools, increasing Medi-Cal reimbursement rates.
Well, UC Riverside just opened a medical school.
Definitely. But, nurse practitioners, optometrists, physician assistants, pharmacists as well. So what we have to do is make sure that we address the primary care issue. And politics being such that you have special interest groups that are going to continue to push back, but I really believe that it's my responsibility to make sure that we get these bills in, we get them passed, but more importantly, that patients have access to primary care.
And what are your constituents saying about the Affordable Care Act? Are they ready? Do they get it?
You know what they're saying is they don't know about it. And that's my biggest concern.
That's the message.
They
the word has to get out.
Don't know about it.
Okay, his name is Ed Hernandez. He's a member of the California State Senate. When we come back, we'll be speaking with Scott Svonkin. He is a member of the Community College District in LA County, but he's coming to join us to speak about insurance. He's a commissioner with the Insurance Commission in LA County itself. I'm Brad Pomerance. It's Charter California Edition. Welcome back to Charter California Edition. My name is Brad Pomerance, and as I said, we are joined by Scott Svonkin. He is the Vice President of the Los Angeles Community College District, but today he is joining us as the Chairman of the Los Angeles County Insurance Commission, which is what, sir?
Well, we're a 10-member advisory body. We advise the Board of Supervisors on insurance matters that affect consumers throughout the county.
Well, there are so many issues that affect consumers throughout the county as it relates to insurance. There's auto insurance, there's homeowners insurance, there's earthquake insurance. Well, let's talk about fire insurance, which I guess usually is part of your homeowners insurance.
Yes.
What can you tell us about fire insurance?
Well, it's critical for people in Los Angeles County to remember it's always fire season. We have seasons in California. It's fire, flood, and earthquake.
Right, very well stated. But mostly fire.
Yeah.
Especially in LA County.
Exactly. And people think of fire season as the summer months, but in Los Angeles, because of the Santa Anas, it goes all the way through winter. And winter comes, November, December?
Right.
So people need to be prepared. They need to make sure that they check their policies, because if you buy a home or you rent, you need to have insurance to cover your home and your possessions. And if you don't update it annually, with the fluctuation in rising home values, you won't be able to replace what you own. And usually it's your number one investment.
Also, renters need to be aware that you can purchase a renter's insurance policy, which actually they're somewhat affordable.
Right.
I mean, they're not exorbitantly expensive, because if an apartment building is impacted, would the apartment building's owner's policy cover the
Not
contents?
usually.
Right.
Usually you need to insure your contents. And the other thing that you can usually purchase is so that you have a place to live, because a lot of times in a major incident, a big fire, if the building's burnt down, the owner of the building may not be able to put you up. But if you have renter's insurance, you'll have a place to stay.
What about clearance issues, brush clearance issues?
Well, if you go to the Los Angeles County Fire Department's website, they have tips on how much clearance you need. And if you live in the foothills in LA County, you should go to LA County Fire and make sure that you're prepared. You want to make sure not only that you have insurance to protect your house, but you want to make sure that you have brush clearance, and that there are a lot of things you can do, whether it's protect the home with appropriate roofing materials, protect it with appropriate windows. There are a lot of things you can do to make your home safer and less likely to burn in a fire.
And this news is relevant for anyone in the state of California. We know what happened recently in Central California. I mean, that region was just decimated by fire that was started, I think, by a faulty cigarette. I mean, it can be devastating.
Yeah, and your home, the most important thing to people is their family, their pets. So you got to have a plan. And at LA County Fire, at the LA County Insurance Commission's website, we have tips on how to be prepared. And so I urge your viewers to go to LACIC.org and check out our tips. And we're going to have a link for your viewers to the county's fire website.
Thank you for that.
Because it's very important to plan and to be prepared, because it's always, whether it's fire season or the rains that follow a fire and you have floods, or
think about what happened in Colorado.
That's right.
This can happen.
Well, and the things that you do to prepare for a fire are very much like the things to do to prepare for an earthquake. Having the right insurance, having a plan for evacuation, having the right supplies.
You mentioned earthquake. Sir, earthquake insurance is so expensive.
It is.
I mean, I really have to say that, how do we get a handle on that? Because it is just outrageously expensive.
It is. The challenge is so few people buy it because it's
so expensive, right?
And it's a sort of a self-fulfilling prophecy. If more people bought it, it would bring the prices down because it would spread the risk.
But isn't it the case that only in California that you can purchase through a state fund? You can't buy insurance privately. It has to be through the state of California?
Well, it's because almost all of the insurance companies walked away from California after the last earthquake.
On the insurance question. So what's your advice on earthquake insurance?
Well, I was fortunate. During the Northridge earthquake, my home was damaged severely. And I was fortunate because I had earthquake insurance. So I was made whole. Very few people in the Northridge earthquake were made whole. I was lucky because I paid it. It's gotten so the policies aren't as rich as they were because the insurance companies have reduced the payoff. But I think that if you have all your life savings in your home, it's something you should look at and talk to your insurance agent and see if you can afford it.
But what people say is, look, if the earthquake is that severe, the government is going to come in and help?
Well,
FEMA.
since Katrina and others, we haven't been able to count on the federal government to be there for us. So I encourage people to have a plan for themselves. And it's a financial decision. Can I afford it, or can I afford not to have it?
I want to ask you about health care. We're in the midst of the adoption of the Affordable Care Act.
Right.
California is, the largest state in the union. LA County would be the 8th largest state in the union. And so what's your sense of the implementation of the Affordable Care Act in LA County and or the state of California?
Well, the Insurance Commission, the State Insurance Commissioner, Dave Jones, and elected officials across this state are encouraging people to go to Covered California's website and to do some research and prepare and plan. It is going to be way more affordable than it was in the past. So if you haven't been able to get insurance, now may be your chance.
Here's what's tricky. Both of us have been presented with challenges getting insurance because of what's known as pre-existing conditions.
Right.
About 6 years ago, I had the opportunity to become a news anchor overseas. And my wife has a chronic illness, and I could not accept the job because I could not get her an international policy because of her pre-existing condition.
Right.
You had a similar situation.
I did. Even though I'm chairman of the Los Angeles County Insurance Commission, I unfortunately was turned down by 3 companies. One, because I have asthma, and my asthma, by the way, has been under control. I play tennis once a week. I chase my kids around.
Right.
So the cost of my medicine was $100 a month, and yet no insurance company would cover me. My wife was pregnant at the time with our second child, and they turned us down because they didn't want the risk of, thank God my son was born healthy. So under the Affordable Care Act, no longer can you be denied health care and coverage for a pre-existing condition.
And so people need to know that.
Yes.
Because I think people are so used to this mantra of pre-existing condition, unless
Right.
you're employed and go into a group plan,
Right.
you can't get insurance.
Under Covered California, they can't deny you coverage for a pre-existing condition. And it's very important that consumers use the website at Covered California to be educated about their options, because there are very rich plans that are a little more expensive.
Platinum,
Right.
yeah, it's platinum, gold, silver, bronze. Right.
Exactly. And it's critical to be an informed consumer. So I hope whether it's your home or your health, that the consumers will ask questions. It's their right.
Are consumers asking questions, or are consumers flummoxed by the choice, not clear as to what they can do?
I think historically, people have always not known what they're getting. And so we encourage people to ask questions. Ask your agent, ask your lawyer, ask your friend, ask a doctor. It's very important to ask people about what is covered. And Covered California has an 800 number. They can contact them.
Right.
And
website, of course.
Yeah. And so it's critical. Having health care is the difference. The number one thing that leads to bankruptcy for people is healthcare crises. So you end up in the hospital and you can't afford to pay.
Is LA County ready for the Affordable Care Act? Because as you know, California has accepted what's known as the Medicaid expansion.
Right.
So California will have more people on Medi-Cal.
Yeah.
And presumably that means more people are servicing or seeking services from LA County Public Health.
We are doing everything we can to encourage people to sign up and to make sure we're ready for when they come to our health centers and hospitals. And the county's been preparing for quite some time for this, working on becoming better at serving its customers, the public. And so I think we are. I'm hopeful that more people will sign up than don't.
Right.
Because if you don't sign up and you make above a certain dollar amount, you're going to be penalized.
And Medicaid expansion is not through Cover California.
It's not.
So you'd have to sign up separately if you qualify for the Medicaid expansion. Okay, his name is Scott Svonkin. He is, in this capacity today, the chair of the Los Angeles County Insurance Commission, also a member of the school board for Los Angeles Community College District. I'm Brad Pomerance. We'll be right back on Charter California Edition. Welcome back to Charter California Edition. I'm Brad Pomerance. We are joined by Michelle Patterson. She is the executive producer of the California Women's Conference. I have attended these conferences and they are remarkable. They are coming back. It is coming back on May 19th and 20th at the Long Beach Convention Center. I am so glad. It's several months away, but it's not too early to talk about it.
It's never too early to talk about it.
So tell us about the California Women's Conference 2014. How did the conferences get started at all?
So the conference started, Brad, 28 years ago by Governor George Deukmejian. So a man started the conference.
Right. And what's interesting about Governor Deukmejian is he is from Long Beach.
Yes.
And that's where the conference will be and has been for quite some time. But what's also interesting is that a young Michelle Patterson knew Mr. Deukmejian way back when.
So 28 years ago, I had the opportunity.
The same year.
Same year that he started the conference, I interviewed him for the 8th grade school paper. So if you can imagine, I'm asking him very important questions. You know, what's your favorite pastime? Right. What's your favorite color?
All right.
How many kids do you have? And he looks at me and he gets done with the interview. He said, Michelle, that was the best interview I've ever heard.
That is sweet.
So of course my face lit up.
Of course.
And I thought, you know, wow, you know, I matter.
Right.
You know, here the governor of the state of California told me that, you know, I can make a significant difference.
And so often, 8th grade girls don't feel like they matter.
You know, we do. We go through that of just, you know, really testing
Right.
our value
Right.
and our contribution.
And what's so special is you've stayed in touch with Mr. Deukmejian. I mean, how wonderful that he is still your friend.
Yes.
How did you keep in touch?
You know what?
You just did.
I had the opportunity, and you know, one of life's full circle moments.
Right.
Here, 28 years later, had the opportunity to continue the legacy.
Right.
And the reason he started the conference was to give women the resources and tools to be successful. At the time, and no different
Right.
from today, women were opening up businesses and they were failing at a rapid rate. And he came in and it was, let's create a conference that brings the resources and tools together.
And he'll be back in 2014?
Absolutely.
Okay.
He's got a permanent seat
I was
right
going
in
to say.
the front row.
So let's talk about the conference. What will happen there? I've been there. They're really terrific. They really are. But tell us, for those that have not been there, what will happen at the conference?
So this is an opportunity for women of all ages to go and really look at all the different things that they themselves want to pursue to reach their full potential.
So you can network.
You can network, you know, there's opportunities to reach out and make mentors. There's opportunities to be a mentor.
And one of the best things I think about the conference is there will be people there that work in the areas of finance. and
Absolutely.
capital.
Well, and again, women, we tend to be risk adverse.
Right.
So what is the process? How do you go about obtaining funding? Last year we had Dolphin Tank.
I like it.
Which, you know, play on words, and
get
it was
it.
a great opportunity for women to go in and pitch.
I recently interviewed a politician. She is the chair of the Board of Supervisors in San Bernardino County. Her name is Janice Rutherford. She has 2 young children. And I asked her a question about how is it being a mother and being the chair? And I realized if this was a father, I would not have asked that question.
Right.
And
Right.
so she teases me about it, and it's well deserved. But that begs the question. At the conference, I presume that you'll be talking about that balance that women make.
Well,
I mean,
and that's why companies and corporations love working with us. It's a place for them to send their employees. And let's talk about those issues.
Right.
Let's
Don't
talk,
ignore 'em.
Let's talk about,
Talk
to
about 'em.
women that are successful, that are doing this. And what's exciting is we're making phone calls and we're talking to organizations throughout the U.S. and globally.
And let's talk about how we can get involved. I mean, literally, it's several months away, May 19th and 20th. And so there are a lot of opportunities for people to get involved at all age levels, all income brackets, whatever your background may be. Tell us about that.
So we've got several programs available. For a company, there's opportunities for you to be a sponsor,
Right.
to come in and actually get a table.
Right, have a booth.
Have
I
a
love those
booth.
booths. I mean, those booths were incredibly informative. I mean, I learned a lot.
Absolutely.
Right.
So there's several ways to participate and engage, and not just for the conference, which is scheduled May 19th
Right,
and 20th,
right.
but it's really looking at it and participating 365 days out of the year.
Well stated.
So
And I understand you have a program for tweens and teens.
We do.
So I want to bring my daughter, who will be 12 then. Tell us about that program.
which is a great age. We started it last year, and I've got a 15-year-old daughter.
Okay, so you know.
So I know exactly, and it was excellent. We had panel discussions, and these amazing, talented teens from all over were able to come in and really talk about the issues that these young girls face.
I want to talk about some of the participants, because I know that you already have quite a cadre of supporters of businesses. Why don't you tell us about some of them? Wow, I mean, I don't know how you did it, but you did.
And what's so exciting, I mean, this is absolutely the conference to speak at, to be at. It's the longest running conference in the United States.
Sure.
It's, again, gone global, and meaning that we've been going to other markets and actually having the conference. So we're now...
Turkey?
Turkey.
I mean, I know it had a female prime minister, but arguably that's a tough country.
Yes. You know, and again, it goes back to the messaging and getting the messaging out there. But we've got speakers like Jack Canfield, you know, Lisa Nichols, Jane Pauley, several others that we haven't announced yet.
And organizations, I mean, can we list them? Because I have some organizations here. Am I allowed to say?
Absolutely.
I mean, you have the First Foundation, Logitech, the United Nations, Memorial Hospital, Susan G. Komen, the American Heart Association. It's a nice kind of mixture of health, big business, small business. And let's talk about small business, because I think it's fair to say that a lot of women are looking to start their own small businesses. What will you be offering those women?
This is exactly where you
Right,
want to be.
right.
This is an educational hub. You've got organizations, another one, NABO, that will be there. This is an opportunity for you to come, interact with those organizations, network, and find the people and the individuals, the teams that can really work with you to help you with starting your company.
So I have a question for you. So I'm a guy, you know, as you can tell, I'm a guy. I have a wife, I have 2 daughters, I have 2 female cats, and so I'm wondering, is there any place for me at the California Women's Conference?
So I get asked this often.
Right.
We absolutely need you at the conference. This is about men and women coming together to support women. It's about collaborating. And I love one of my favorite quotes when Warren Buffett says, he says he's optimistic about America's economic future because the nation has begun to unleash the potential of women. So imagine what we've seen and we've been able to accomplish when we use 50% of our human capacity.
Right.
What happens when we tap into 100%? And this is about helping women reach their full potential.
And I will say that having been at a prior conference, there were plenty of men walking around. And I think, as you suggest, and as Mr. Warren Buffett all but said, they've arrived. You know, I am woman, hear me roar, and they're roaring loudly.
They are,
in
and
our
women
economy.
represent 78% of the consumer, 85% of the decision maker in the household. So
in my house, it's 100%.
companies,
be that as it may.
but companies want to speak to this demographic, and that's why you want to make sure, do not miss out on being at this conference.
So tell us how we can get involved. There are very specific ways, meaning logistically, how do we get involved? I presume you have a website, you have emails. What do we do?
So you can reach us at womennetworkfoundation.org.
Which is the umbrella organization that runs the various women's conferences around the world. Okay.
Yes. You can also go to the California Women's Conference.com and you can reach us there. And there's so many different ways. Again, find out about how to be an exhibitor,
right,
a sponsor, a volunteer.
I was going to ask you about volunteers because, wow, I mean, you're going to need a volunteer army.
We do.
A huge army. I mean, that hall at the Long Beach Convention
I've already signed you up.
I can't wait. I can't wait.
I have a warning label. After 7 minutes, you're signed up for something.
No, but honestly, you are going to need an army
We do.
of men and women to support this event, because that convention center is massive. And not only is there the exhibitors hall, but there's the speakers and the breakout sessions. And so
when we look at last year's conference, there's 1,000 people that come together to make that conference happen.
I have to say thank you for what you're doing. You know, on behalf of my wife and my daughters and the women of California, thank you.
Well, we look forward to having you there.
Absolutely. Her name is Michelle Patterson. She is with the California Women's Conference being held on May 19th and 20th in Long Beach at their convention center. I'm Brad Pomerance. This is Charter California Edition.